Okay, bag valve masks or BVMs. The variety of sizes, we have the infant here, pediatric, and the adult. When we use these, we want to make sure we use the appropriate size bag for the patient so we don't overinflate the lungs. Really, they all operate the same way. They all have a mask. They all have different airway attachments, oxygen, and other medication type ports, right? They simply work by squeezing, we're not over squeezing, we're just squeezing until we see chest rise and fall. And that's how we do it with all of them. They all operate the exact same way, right? That's just your infant one right there. Your next one would be your pediatric. This is going to be slightly larger. This is going to have the same thing, the mask, all the airway attachments for oxygen and whatnot. Same thing, that we squeeze it, making sure we don't over squeeze, just squeezing until we see chest rise and fall. The adult, it's the same thing, right? They often come caplopes like this, depending on the brand. They expand them. You get them all set up. Little handles, you don't have to use them. Oxygen port, bag, reservoir, they work the same way, right? Now the important part is going to be the mask itself. So when we use that, their nose goes in the narrow part and the chin goes down below. We're going to apply it to the face just like so. We're going to put our hands on the inside and kind of stretch it out. What this does is as we apply it and let go, it suctions the face. Now we're going to do our CE grip. The CE grip is just that, right? C and then the E or 3, C3 or CE. Right? The important thing there is I'm grabbing the chin and not the soft spot. And I'm kind of opening the airway as I'm pulling up into that, securing my airway. When I bag my patients, we're never going to squeeze this bag fully, right? We're only squeezing until we see chest rise and fall. We're going to go 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, 1, 2. Right, this entire time making sure we have a good tight seal and we're getting good ventilation.